Let me see. So this is the cardiovascular disease, right? But cardiovascular disease about the pediatrics section. So in this discussion, we are going to learn something absolutely new, what you do not know. So, like example, I want to tell you, blue baby. What is blue baby? Pink baby. Does it mean pink baby? What are the tetralogy of Fallot, right? And definitely uh, related to this cardio pediatrics, we has to know what is ASD, what is BSD, what is PDA, and we have to know what are the transposition of the great vessel, what is tricuspid atresia and tricuspid arteriosus. So in this PowerPoint, we also will find out what are the key points need to know for NCLEX board exam. Okay. So if you really want to know the pathology of the heart disease, first of all, we have to know the normal anatomy of the heart. Then we have to know the normal blood supply to the heart, right? So let me continue the normal anatomy first. Within short time, I will discuss it with you. So heart, this is the heart, right? The heart basically contain the four chamber. My friend, I'm going to tell you the normal anatomy of the heart. At the same time, I will tell you what are the disease, congenital disease, and what are the normal blood flow in case of congenital disease, what blood flow take change. The pediatrics cardiology basically talk about the congenital heart problem. It is called congenital because the baby born with heart problem. So if we do not correct this problem, if baby carry with this problem, it will cause a big problem in future. But at the very beginning, if we identify the problem, it would be easy to get correct. And baby, especially the infant baby, they do not know they have heart disease, and they do not tell mommy I have a heart problem. They do not say mommy I have a congenital heart disease, right? They do not tell it, but mother has to know how to see what is the problem of my baby. Simply, if baby do not eat, if baby refuse to feed, if baby cry too much, indicate there's something wrong, something abnormal with my baby. As a RN or LPN or the doctor, if you work in the hospital, to see the sign and symptom, you can find out what is my client problem. To find out the problem, definitely you have to have very clear knowledge about the anatomy, about the physiology, about the disease process called pathology. And when you have diagnosed the disease, that times we give the treatment, pharmacology. We should know the pharmacology as well. So normal function and structured abnormality lead to the disease called pathology. After diagnosis the disease, we need some laboratory studies. What is support your diagnosis, clinical diagnosis, and give the treatment, right? And all of this is a medicine. But some problem we need to correct by surgical operation. It is called surgical unit or surgery, right? So I said all of the science is coordinate with each other. So first of all, here, some of you really know, but all of you is not equal, and every student is very important to me. I'm going to talk about for all. So this is the structure of the heart, and heart is divided into the four chamber. So this is the right atria, right ventricle, left atria, and left ventricle. So if I divided the heart right and left, in the right side, two, right atria, right ventricle, left side, left atria, left ventricle. So if I divide it up and down by a horizontal line, it should be two atria on the top and bottom, two ventricle. So two ventricles are divided by a wall, and this wall basically called septa. More accurately, interatrial septa. Same as two ventricle divided by interventricular septa, or is it called wall. This wall or septa partition between right ventricle and left ventricle. But if any abnormalities in between this wall opening, that times blood is getting mixturing. If blood get mixture, what are the problem? Problem because in this circulation, the blood is go from head, neck, or upper extremity through the superior vena cava to the right atrium, and from your two legs or lower extremity, abdomen, thorax, blood go through the inferior vena cava, finally go inside right atrium, right? This is the right atrium. From right atria, blood supposed to go from right atria to right ventricle. From right ventricle, blood supposed to go to pulmonary tongue, finally lungs. When blood come or drain from upper or lower extremity to right atria, this blood is deoxygenated, means blood contain carbon dioxide, and this blood go from right atria to right ventricle, from right ventricle to pulmonary tongue to the lungs, where deoxygenated blood is get oxygenated, gas exchanged, right? When get exchanged, the blood get oxygen, so this pulmonary vein carry the oxygenated blood from lungs to left atria. From left atria, blood supposed to go to the left ventricle. From left ventricle, blood supposed to go to arch of aorta and distribute all over the body. All over the body. But question comes when or why the problem start, right? As I told you, this side blood contain carbon dioxide, but this side blood contain oxygen, right? And this side blood just collected from the body, and this side blood distribute to the whole over the body. The problem, if the any kind of opening in between two atria, the blood is go from right atria to left atria. I said the wall is called atrial septa. If this wall is opening, this is called atrial septal defect. This is called atrial septal defect. One problem. So if you ask me, if blood mixturing here, what's problem? The problem is when blood is go and mix carbon dioxide blood to oxygenated blood, this carbon dioxide mixed blood go in the circulation. When blood go in the circulation, what is the carbon dioxide? Your tissue or cell do not get enough oxygen. Deficiency of oxygen called hypoxia. If patient has hypoxia, they easily get tired, right? And also so many complications start, like heart is work more because of demand is increased in the tissue level. Finally, heart failure. Another problem sometimes occur, like this is the atria. Atria supposed to be opening here. Opening here is called valve, tricuspid valve. So because of this opening, when atria contraction, valve is open, oxygen go from right atria to right ventricle. Problem. Sometimes this tricuspid valve are absent or tricuspid valve does not open up. This is called tricuspid atresia, right? Another problem sometimes occur. This is the right ventricle. This is the left ventricle, separated by ventricular septa. Unfortunately, some of the baby, the ventricular septa is not intact. Opening is there. That times again, deoxygenated blood and oxygenated blood is getting mixturing, right? And this type of defect is called ventricular septal defect. Ventricular septal defect, right? Another problem, blood supposed to go from right ventricle to the pulmonary tongue to the lungs. Unfortunately, sometimes the pulmonary artery is too narrow or stenosis there. That times blood not go natural way from right ventricle to the lungs, right? Some of the baby or has a problem, the aorta is so narrow, okay? Aortic stenosis, blood does not go and continue this problem. So let me show you some picture so you can easily understand what are the problem. So okay, not here. Here, this is the normal heart right? And this is the abnormal heart, or we said the fourth problem. This fourth problem, what baby born with, this is called tetralogy of Fallot. Tetralogy of Fallot. So tetra means four, tetralogy of Fallot. So I said, you see, this is the atria ventricle. This is the atria, right side, normal picture, right atria, right ventricle. And this is the wall. Some unfortunate baby, the wall is too thick. If this wall is too thick, the room is inside in the wall should be small or short. If it is very small, the room is not enough to occupy the blood from right atria. So when the problem is this, too much hypertrophy, this is called right ventricular hypertrophy, one of the problem. Another problem is, as I told you, the two, this is the ventricle, right ventricle and left ventricle, separated by septa. So opening is there and blood is getting mixturing, right? Blood is get mixture. So it is called ventricular septal defect. Ventricular septal defect. And in normally, this is the pulmonary tongue. Pulmonary tongue sometimes too narrow like this. And this is called pulmonary stenosis. If it is pulmonary stenosis, blood will not go normally, right? Because of narrowing, pulmonary stenosis. Another problem here, another extra sac is developed, and this is called overriding aorta. Overriding aorta. So all of this is a all of these four problem together is called Tetralogy of Fallot. In pediatrics cardiology, we are going to talk about more disease like transposition of the great vessels, tricuspid atresia, or truncus arteriosus. Truncus arteriosus. We said, if your baby has a this type of problem, if we not treat it, baby go to face or this type of problem lead to the heart failure. But heart failure is most common in elderly patients who have atherosclerosis or who have angina or myocardial infarction, right? So in case of adult, this is the another disease. But in case of the children, why heart failure is common to them? Because of congenital heart disease, right? So in case of heart failure, so the pediatrics cardiology, we are talking about the congenital heart problem basically, right? Because congenital heart problem lead to the heart failures, especially. So congenital heart problem are the anatomical abnormalities of the heart. So this is the anatomical abnormalities, all tetralogy of Fallot or overriding aorta, pulmonary stenosis, ventricular septal defect, or right ventricular hypertrophy. So all of these are congenital anomaly. So congenital heart disease, as I told you, this is the anatomical structural abnormalities, right? Why structural? Because this is the ventricular septa opening there, abnormal. Atria, atrium are opening, or stenosis, overriding, all are structural. So the key symptom of this congenital heart disease lead to the heart failure and hypoxia. Hypoxia means the lack of
oxygen
supply to the tissue. So as I told you, all congenital heart disease lead to the heart failure. So we have to know what are the signs and symptoms of heart failure here. So the heart failure is inability of the heart to pump up sufficient amount of the blood to meet the metabolic requirement or oxygen demand to the body. So I said, what are the food of your brain? What are the food of the cell of your body? Oxygen, right? You eat chicken legs, but your tissue eat oxygen. They need oxygen to continue the chemical reaction, and this chemical reaction is called metabolism. By this chemical reaction, produce the energy as a ATP. Because of this energy, you are sitting in front of computer right now, right? So if we have a congenital heart disease, as I told you, it is lead to the heart failure. So we must know what are the signs, symptom of heart failure. So the infant and children, inadequate cardiac output is the most commonly caused by congenital heart failure. So congenital heart failure lead to the inadequate cardiac output to the tissue. When tissue demand of oxygen increase, they send a signal to the brain send a feedback to the heart, and heart is work more. When heart is try to work more, overload, but they do not pumping enough oxygen. Finally, heart is failed. So heart failure, congenital heart disease, one of the problem of shunt. Shunt means blood supposed to go from right ventricle to the pulmonary aorta, then lungs, from lungs to um, right left atria, from left atria to left ventricle, right? And left ventricle to the arch of aorta. This is the normal dimension of the blood flow, forwarding flow. But if any abnormalities in this septa, ventricular septa, blood have to go the
backward.
flow right, left ventricle to the right ventricle. And this is the when right to left ventricle, right? And this is called shunt. So I said at least you have to have a little bit clear concept about the terminology or congenital heart defect patient develop maybe for obstruction or combination of both shunt and obstruction. Both of them produce an excessive volume or pressure load to the muscle tissue, cardiac tissue, and this is called myocardium. In infant and children, a combination of both left or right heart failure is usually present. Something is important, my friend, we should know. The workload is more in the left ventricle. So left ventricle need more oxygen, right? And most common heart failure occur because of left ventricular failure. If any pathology in the right ventricle, we said right ventricle failure. Right ventricular failure or right side heart failure lead to develop left side heart failure. When left side heart failure, both are cause both heart failure or congenital CCF, congestive heart failure, right? So as I told you, the heart failure, definitely we have to know what are the sign and symptom of heart failure. We say data collection, right? Data collection from the patient. When a patient come to you, we have to take a proper medical history from the patient, right? From the patient, we take medical history. So if your patient have a heart failure, patient develop if any condition when we are disease, we are undergo the anxiety. Anxiety increase anxiety, increase the palpitation. It is palpitation increase, anxiety increase, heartbeat increase. And when excess heartbeat, we said tachycardia or increase the respiratory rate is called, or increase the pulse rate called tachypnea. Profuse sweating is called diaphoresis. Patient feel fatigue and tired, irritability because your tissue does not get enough oxygen, and also sudden weight gain because of fluid retention, right? If you have a heart problem, fluid accumulate in the leg, pitting edema develop. If you have a liver problem, fluid accumulate in the abdomen. It is called ascites. If your patient has a kidney problem, fluid accumulate in the face. Facial edema develop. Also, heart failure patient develop shortness of breath or respiratory distress. So, if impair the heart function because of congenital heart disease, most common sign symptom tachycardia or hypotension or pallor, weak pulse, patient feel tired, fatigue, and all of this condition finally lead to cardiomegaly, heart size increase because of over workload. Some of the patient develop the pulmonary congestion. If patient develop the pulmonary congestion, symptoms are tachycardia, dyspnea. Dyspnea means shortness of breath or nasal flaring, retraction of the respiratory muscle, and develop. If you put the stethoscope over the lungs, we can get wheezing. Also, if your patient develop the heart failure, we will get the systemic congestion. When patient develop the systemic congestion, we will get the symptom like peripheral edema or ascites, hepatomegaly, neck vein distension, right? So all of these are related each other. The most common sign and symptom develop when patient has a heart failure. Patient develop hypoxia, right? Patient develop the hypoxia. And if patient have a hypoxia, patient develop cyanosis. You can see in this picture, blue discoloration around the lips or tip of the nose, tip of the finger or hand. So cyanosis is most common sign of hypoxia. Or some patient develop the trachypnea, dyspnea, or clubbing in the finger. So this is the clubbing finger. So normal finger, the curvature look like this, but the clubbing finger, this is the convex. If you go to put two fingers together, we can see the shape, diamond shape, right? So all of these are the sign of congenital heart problem. So now we are going to focus as a LPN or as a RN. What is our roles if my patient has a heart failure, right? So nursing intervention, right? We have to know intervention. So keep in mind our first priority to monitor the vital sign, right? Also monitor the respiratory distress or monitor the apical pulse. So apical pulse means measure the pulse rate over the heart, right? Apical pulse, we has to count 1 minute full or 60 seconds. NCLEX board asks this question. Apical pulse, how long you have to count? 1 full minute, right? When we count the pulse over the wrist, it is called radial pulse. The pulse between the difference between apical pulse and radial pulse, this is called pulse deficient, right? What else? What next? So nursing care or nursing intervention, when patient has a congenital heart problem, we have to provide frequent rest. We have to provide frequent rest. We have to give the cluster care, provide small and frequent meal, right? Provide small and frequent meal. Also use we are talking about the pediatrics, not adult. So pediatrics, baby, infant congenital heart disease, we use the nipple with the enlarged opening for feeding. Also use high density formula for the baby. Also minimize the crying. Position of the child should be semi-polar or polar posture, means bed more than 45-degree angle. And also, if your patient has a hypoxia or cyanosis, place the child in knee chest position and claim the child. So I told you all of the information we have to know because we are RN, we should know, right? So in this PowerPoint, I put some different color. So this is the keyword we should know. So if my patient has a congenital heart problem, we has to monitor the vital sign like temperature, respiratory rate, blood pressure, and pulse rate. We also monitor this strictly input and output for kidney function. We has to check patient everyday daily weight for fluid retention because heart failure patient causes the fluid retention in their feet. It is called pitting edema. And also we has to monitor the facial or peripheral dependent edema. We has to put the stethoscope over the lung to listen any abnormal lung sound. We has to give the comfortness to the patient. So patient position is super important, right? We tell them we keep them semi-polar or polar posture. Maintain the neutral thermal environment to prevent the cold stress in infant. So what next? What next? Right? So if a patient come to you, definitely we are not MD. We has to wait for the prescription by healthcare provider. But what we should do, right? We should stop or prevent the or decrease the environmental stimuli. We admit oxygen. Make sure the oxygen is humidified oxygen, right? And also organize the nursing activities, maintain adequate nutritional status, provide small, frequent feed, and also conserve the energy and oxygen supply. Usually, the patient treated by digoxin. Digoxin is a medication for heart failure that improve myocardial contractilities. They treated by ACE inhibitor. It is called angiotensin converting enzyme like captopril. Captopril reduce the afterload. We treated by beta blocker like metoprolol, decrease the heart rate or blood pressure. We treated by diuretics like furosemide. What is eliminate excess fluid and sodium, right? So basically, this type of patient is diagnosed by EKG. So EKG monitoring also important. Chest X is important. Echocardiogram is important. And finally, cardiac catheterization, right? So what else? What next? As a RN, we has to admin digoxin as prescribed, right? In NCLEX board, when we get anything as prescribed, it is the answer is needed, right? So check the apical pulse rate for 1 minute before give digoxin. If we found the apical pulse rate less than 90 to 110 beat per minute in infant or young children, we has to hold. If we get less than 70 beat per minute in old children, we should hold the digoxin and we has to talk to the healthcare provider. In case of adult person, if we get the pulse rate less than 60 beat, we has to hold the digoxin, right? So also be aware that the infant rarely received more than 1 ml of digoxin in one dose. So why digoxin is so important? Because digoxin is a life-saving medication in case of heart failure. Same time, the therapeutic index rate of digoxin is very low. So we have to check the digoxin blood level because digoxin can cause the digoxin toxicity, right? So I said we have to know what are the digoxin toxicity sign symptom. So digoxin toxicity signs seem to include anorexia, means decrease the appetite, poor feeding, vomiting, bradycardia, abnormal heart rhythm. Also report any sign to if we get any sign and symptom of the digoxin toxicity, we have to notify the healthcare provider or notify the registered RN. So normal digoxin level is okay if it is 0.5 to 0.8 nanogram per ml. But if digoxin level is more than 0.8 nanogram, it indicates digoxin toxicity, right? So what else? What are the other treatment option in case of digoxin heart failure? As I told you, we give them angiotensin converting enzyme inhibitor as prescribed. Always as prescribed is the answer in select all question, right? Angiotensin inhibitor, shortly called ACE inhibitor, like captopril, they reduce the afterload. Admin the beta blocker like metoprolol, they reduce the heart rate and blood pressure. Admin diuretics such as furosemide, Lasix as prescribed. So basically, diuretics eliminate the excess fluid and sodium, right? So here, admin the potassium supplement and also provide dietary resource of potassium is prescribed. So basically, when we prescribe the Lasix or diuretics, they eliminate the excess fluid and sodium from the body, When excess fluid loss, it leads to imbalance of electrolyte, especially potassium. If we do not correct the potassium, they lead to arrhythmia, dysarrhythmia, and patient die because of arrhythmia. So we has to give potassium containing food. So question come, what are the food contain enough potassium? Or question sometimes come, a patient has a heart failure, taking the digoxin, waiting to the restaurant and reading the menu, what food is good for them? Means potassium rich food is good, right? So potassium containing food are banana, baked potato, peanut butter, all are potassium good source of food. We also monitor the serum electrolyte level, particularly potassium level. So what are the normal range of potassium? It is 3.5 to 5. So we has to find out hypokalemia or hyperkalemia. Both are bad. Both are lead to heart failure, dysarrhythmia. Also limit fluid intake as prescribed in acute states. Monitor the sign and symptom of the dehydration, because excess fluid out, eliminate the excess fluid can lead to the dehydration. So we must know what are the sign and symptoms of dehydration, right? So the sign symptom of dehydration are sunken fontanelle or non-elastic skin trigger, dry mucous membrane, decrease the tear, right? And also decrease the urine output. So in this picture, you can see this baby, his eye is sunken eye, right? Sunken eye is a prominent uh, feature of dehydration. Or if we see in this picture, the tongue is dehydrated, coated tongue. This is the coated tongue. And also, if you pinch the skin supposed to be back very late, but it's supposed to go get back reposition within a second. But in the case of dehydration, the skin will decrease the trigger, remain elevated after being pulled up and released. So now sodium is also very important electrolyte. We have to check the sodium level as well. So question come, what are the normal sodium level, right? The normal sodium level are 35 to 140 milliequivalent, right? So if it is less than this, it's called hyponatremia. If it is more than this, called hypernatremia. So also many infant formula have a slightly more sodium than the breast milk. We has to educate or reinforce instruction to the parents regarding the description of diagnosis and administration of medication. So next, what are the continuation of heart failure? So reinforce the instruction to parents for cardiopulmonary resuscitation, or shortly called CPR. So, question: if you do not get any pulse, if you do not get any heart rate, if you see the eye is dilated or, or fixed, we have to start the CPR. But in case of adult CPR, in case of infant, it is not same. We have to follow the guideline for CPR for the child older than 1 year age, as same as the adult. But in case of infant, we have to use the 2 finger and push the pressure. How many times we have to push? 30 times, right? 30 times. So next here, another disease we are going to talk about, the congenital problem, is it is called defect in with increase the pulmonary blood flow. So decrease the congenital heart disease, which is lead to increase the pulmonary blood flow. So intracardiac communication along with septum or abnormal connection between the great arteries allow the blood to flow from high pressure left side of the heart to the low pressure right side of the heart. Another congenital heart disease is called atrial septal defect. Atrial septal defect, right? So in case of atrial septal defect, what we have to know from here, atrial, I said this is the abnormal opening or hole in the septa between left and right atria, right? So as I told, this is the heart, this is the right atria, this is the left atria. So abnormal opening in between 2 atria, and this is called atrial septal defect, shortly called ASD, right? ASD. So ASD or atrial septal defect, I said abnormal hole in the septum between left and right atria. What are the most common symptoms? One is we have to get loud or heart's murmur, abnormal murmur with a fixed split second heart sound, right? The treatment of ASD, they closer during the cardiac catheterization. So abnormal opening between atria that causes an increase the blood flow of oxygenated blood into the right side of the heart. The right atrial and ventricular enlargement occur, and also infant be asymptomatic, right? Or in future develop the heart failure. So what next? Next here, the atrial septal defect sign and symptom, decrease the cardiac output, right? As I told you, we can get the abnormal murmur, and this is called loud heart's murmur, right? The management may be closed with the use of a device during cardiac catheterization, right? So sometime I said it is not necessary, but I said little bit information about the cardiac catheterization because nursing care of cardiac catheterization is important. So if a patient is need to catheterization, we has to need pre-procedure, right? Pre-procedure means before cardiac catheterization, what we should do. Access for we has to find out any kind of allergens to iodine or shellfish. Nothing by mouth before 4 to 6 hours prior to procedure. Also, locate and mark the pedal pulse. After procedure, we has to do something, means we has to assess the pedal pulses, also insertion the site for bleeding, maintain the affected extremities is slightly positioned for 4 to 6 hours. Also encouraging to increase the fluid intake to excrete the dye from the body. No tube bath, no tub bath for 3 days. Also limit the activities for 24 hours. Okay, this is important about the cardiac catheterization. So another defect is called arterioventricular. Arterioventricular means like this picture. This is the right atria. This is the right ventricle. In between atria and ventricle, this is called atrioventricular, right? Atrioventricular. So if the defect is here, either right or left, atrioventricle, this wall, this is called atrioventricular canal defect. The result, basically, the result from incomplete infusion of endocardial caution, most common cardiac defect in the children who have a Down syndrome. So Down syndrome is a genetic disease, especially the chromosome number 21 defect, Down syndrome. So the baby who born with Down syndrome, they have a chance of develop the congenital heart disease, especially arterioventricular canal defect. If the baby have a arterioventricular canal defect, we can get the characteristics murmur, right? The murmur is present. So arterioventricular canal defect, other sign and symptom here, we can get the cyanosis. We can get the cyanosis, I said, right? You can see cyanosis. This is the cyanosis. Blue discoloration because lack of oxygen, and also sign and symptom of the decrease the cardiac output. Okay. Another heart disease, congenital heart disease called patent ductus arteriosus. It's called patent ductus arteriosus. So this picture, this is the arch of aorta and this is the pulmonary trunk. Before the birth, some of the baby have a channel in between trunk and artery. But after the birth, this pathway supposed to close, right? But unfortunately, some of the baby do not fuse this channel, and this is called patent ductus arteriosus. I can show you a picture of patent ductus arteriosus. Ductus arteriosus, you see, this is the pulmonary tongue, this is the arch of aorta. Before birth, this is a special pathway or channel which is communicate pulmonary tongue with arch of aorta. But after the birth, this channel should be disappear or close. But unfortunately, some of the baby have continued with this channel, and this is called patent ductus arteriosus, shortly called PDA. So ductus arteriosus, especially fetal artery connected to the aorta and pulmonary artery. So this is the pulmonary tongue or artery. This is the arch of aorta. A abnormal connection continue even after birth, or we can say fail to close after birth. If the baby have a patent ductus arteriosus, we can get abnormal murmur, and this is called machinery murmur. Sometimes question come, in case of ductus arteriosus, what murmur you will get is called machinery murmur. Murmur means abnormal heart sound. Heart can produce two sound, S1, S2, sometimes S3 and S4. If you get any extra sound, this is abnormal. This is murmur. And also we can find rebound pulse, wide pulse pressure. If you ask me, in case of patent ductus arteriosus, what are the treatment? Administration of indomethacin or occlusion of patent ductus arteriosus, right? When occlusion? During the cardiac catheterization. So let's go back. I'm going to read it for you. Patent ductus arteriosus or PDA, failure the fetal duct arteries to close with first week of life, and a characteristic machinery like murmur is present. The infant may be asymptomatic, or he or she may the sign and symptom of the heart failure. We can get widening pulse pressure, also bounding pulse. The sign and symptom decrease the cardiac output present. And management or treatment is indomethacin or occlusion or closing during cardiac catheterization with coils. That's it. Next one is called ventricular septal defect, right? Ventricular septal defect. I already show you in picture. If the here this ventricular septal, so this is the ventricle, right? and left. If any abnormal opening in between the ventricle is called ventricular septal defect, shortly called VSD. So VSD, it is the abnormal hole in the septa between left and right ventricle. The key point basically that if we examine the patient, we can get loud, harsh murmur at the left sternal border. Definitely, if you ask, the treatment is closer during cardiac catheterization. So I said ventricular septal defect. I'm going to read one more time for you. Abnormal opening between the right and left ventricle, and also BSD, shortly called BSD, close spontaneously during the first year of life. If patient have it, we can get characteristics murmur, and this is called loud, harsh murmur. Also present has a sign symptom of the heart failure, and treatment option is closing during cardiac catheterization. What next? Obstructive defect. Obstructive defect. Now, here, obstructive defect, basically, we talk about the coarctation of aorta. We'll talk about the pulmonary stenosis or aortic stenosis. All of them are obstructive, means blood flow should be obstructed, should be stopped. So obstructive defect, blood exit the heart, meet the area of anatomical narrowing is called stenosis. Thus causes the obstruction of the blood flow, right? So here we go next. The first obstructive defect are pulmonary stenosis. So like this is the picture, this is the arch of aorta. This aorta is narrowing, right? It is called aortic stenosis or narrowing the aorta or aortic valve basically. And the key symptom, patient develop hypotension, decrease the pulses, patient develop tachycardia or exercise intolerance. In that type of problem, we give the treatment called balloon dilatation or valvotomy or valvotomy. So let's go and read it here. Aortic stenosis is a narrowing or structure of the aortic valve defect, right? What is causing resistance of blood flow from left ventricle into the aorta and resulting in decrease the cardiac output, lead to the left ventricular hypertrophy and pulmonary backflow, and this is called congestion. The cause of pulmonary stenosis, the structural stricture or narrowing or valvular stenosis, right? And if the patient has aortic stenosis, we will get characteristics murmur like the ASD or BSD. And also the treatment option are balloon dilatation or valvotomy. And also we give palliative care, and symptomatic treatment. The second obstructive pulmonary defect are called coarctation of aorta. Coarctation of aorta. So, what is coarctation of aorta, right? So, this is the normal heart, and this one is the coarctation of aorta. So, in this picture, showing arch of aorta communicating with this and narrowing of the aorta here, and also the arch of aorta communicate with the pulmonary artery through the patent ductus arteriosus. I said patent ductus arteriosus is one of the congenital problem. It should be okay before birth, but after birth, if it is continue, this is called patent ductus arteriosus, right? And here, this picture, let me show. Coarctation means the coarctation of aorta is localized narrowing near the insertion of ductus arteriosus. So coarctation of aorta. So if the narrowing of aorta close to ductus arteriosus, this is coarctation of aorta. It is here, coarctation of aorta, narrowing. So narrowing of the aorta at the ductus arteriosus, close to the ductus arteriosus, narrowing close to ductus arteriosus, right? So which is obstruction of the blood flow from ventricle. So coarctation of aorta, the key symptom basically elevated the blood pressure and also bounding the pulse in the arms and decrease the blood pressure and pulse in the lower legs along with collar skin. So NCLEX board asks a question: in case of coarctation of aorta, the blood pressure is higher in upper extremities, means two hand blood pressure is high rather than two legs, right? In addition, the bounding pulse in the arms, weak or absence the femoral pulses or lower extremities, or cooler or cool the two legs or lower extremity may be present. So I said it is NCLEX board like this question. I want to recap it. In case of coarctation of aorta, the blood pressure is elevated in upper extremity, also bounding pulse in the arms, but blood pressure is reduced in the lower extremity and pulse is reduced in the lower legs, right? And also lower leg skin should be cooler. This is the question asked, right? In this picture showing the ductus arteriosus, close to ductus arteriosus, the narrowing the aorta, and this is called coarctation of aorta. Same thing is here, coarctation of aorta, close to the ductus arteriosus, narrowing the artery, right? What next? Next is the pulmonary stenosis. In this picture, the showing normal pulmonary artery, pulmonary tongue, but here showing the pulmonary tongue is narrowing. This is also obstructive pulmonary defect, right? So pulmonary stenosis, basically narrowing the pulmonary valves, narrowing the pulmonary valves here. So narrowing the entrance of pulmonary artery, resistance the blood flow, and pulmonary atresia means abnormal structure. The key symptom, we should get the systolic ejection murmur or characteristics murmur present. Sometimes patients are asymptomatic, right? And what are the management? Management are dilatation of the narrowing valve, right? Dilatation or balloon angioplasty or valvotomy means correction in the valve. Dilatation of the narrowing the valve may be due during the cardiac catheterization. So you can see the pulmonary tongue in the picture number 1. This is a normal, but picture number 2 showing the pulmonary tongue is narrowing. This is the valvular defect or narrowing the pulmonary tongue. So it is have done the obstructive pulmonary disease. So obstructive pulmonary disease are coarctation of aorta, pulmonary stenosis, and aortic stenosis. Now we are going to talk about some congenital heart disease. They decrease the pulmonary blood flow, decrease the pulmonary blood flow, right? And also some of the defect of the baby or infant, they have a mixed type of blood flow problem, mixed type of blood flow problem. Like I said, the transposition of the great arteries or truncus arteriosus or hypoplastic left heart syndrome. So whatever, now go for decrease the pulmonary blood flow. Obstructed pulmonary blood flow and anatomical defect. This is called ASD and BSD is anatomical defect. But obstructive pulmonary defect, what we discussed few minutes ago, the coarctation aorta, pulmonary stenosis, or aortic stenosis. So other major problem of the baby, it is called the Tetralogy of Fallot, right? Tetralogy of Fallot, there are 4 combined diseases. Together is called Tetralogy of Fallot, right? If we go in this picture, these 4 diseases together, right? So basically, Tetralogy of Fallot included the 4 defects. One is pulmonary stenosis, one is right ventricular hypertrophy, one is overriding aorta, and one is ventricular septal defect. The key symptom, the baby have a cyanosis or hypoxia, right? So here, this is the 4 disease name, what is called Tetralogy of Fallot, and here showing baby has a cyanosis or hypoxia. Hypoxia means less oxygen supply to the blood. What are the treatment of Tetralogy of Fallot? The treatment, the surgical repair with first year of life. If baby does not correct the Tetralogy of Fallot, they develop or increase the cyanosis squatting, clubbing of the finger, and also poor growth may occur. So treatment option is surgical correction, right? Surgical management, complete repair if necessary, usually perform the first year of life. Okay. Also, we said Tetralogy of Fallot, they have a common sign of the clubbing the finger. This is the usually the finger is concave, but this kind of Tetralogy of Fallot, the fingernail are convex outside, right? And this is called clubbing finger. And what next here? And another problem of something important, let me share with you. And I said the uh, tricuspid atresia, tricuspid atresia also decrease the pulmonary blood flow problem, right? Tricuspid atresia, in this picture, if I go, this is the right atrium, this is right ventricle. So here the truncus, tricuspid, tricuspid valve defect, right? Trunk here. So go back here. So tricuspid atresia, right? In the picture, this picture showing the right atria, and this is the right ventricle. Okay, so if blood supposed to go right atria to right ventricle through a valve is called tricuspid valve. If this valve does not open up or closed, not open, this is called tricuspid valve defect, developmental anomaly. So blood does not go right atria to right ventricle, right? And blood supposed to go the backflow and congestion occur. So if this type of problem is occur, this is called tricuspid atresia. Tricuspid atresia is a complete closure of the tricuspid valve and require ESD or BSD to be present. The key symptom of tricuspid atresia, this is a failure of tricuspid valve to develop. There are no communication between right atria and right ventricle, right? Blood flow through ASD or patent foramen of oval and often associated with pulmonary stenosis or transposition of great arteries. So the key symptoms are cyanosis or silent symptom or cyanosis, shortness of breath or dyspnea, tachycardia, hypoxemia, and clubbing. The management of this type of problem are surgery. So surgical management in 3 stages. One is shunt placement, one is Glenn procedure, and modify frontal procedure. So anyway, the management are surgical, right? Tricuspid atresia, what I explained a few minutes ago, the complete mixture of unoxygenated and oxygenated blood in the left side of the heart, which result in systemic desaturation or pulmonary obstruction and decrease pulmonary flow. And sign symptom: data collection, cyanosis, tachycardia, fatigabilities, dyspnea, right? And management is surgical management during cardiac catheterization.